How often have you brushed off the flu as a mere inconvenience? Yet this common respiratory infection caused by the influenza virus can have dire consequences for those considered high risk, such as the elderly or those with comorbidities. The flu vaccine needs yearly updates to keep pace with the virus's variations. According to the World Health Organization, between 3 and 5 million people around the globe suffer from severe flu every year. The most effective prevention method remains vaccination, and as immunity from the vaccine can wane over time, an annual dose is highly recommended. Today, we delve into what you need to know about the annual flu vaccine, how it works, its efficacy, how to get it, what's new in 2024, and much more. To help us with this, we have Dr. Ana Rosa dos Santos from the Sabin Group. Influenza, more commonly known as the flu, is an acute viral infection that affects the respiratory system. It can hit anyone, but is most severe in children between 6 months and 5 years, people over 60, and those in high-risk groups. The influenza virus comes in types A, B, C, and D. The A and B types are the main culprits behind seasonal flu. The A-type viruses are subdivided based on the proteins on their surface, like H1N1 and H3N2. On the other hand, B-type viruses are divided by lineage, with the Yamagata and Victoria lineages currently in circulation. Symptoms of the flu usually appear within 2 days of exposure to the virus and include sudden fever, cough, headache, muscle or joint pain, sore throat, runny nose, and general malaise. These symptoms typically resolve on their own within about a week, but the cough, malaise, and fatigue can linger for weeks. In some cases, especially in individuals with risk factors or conditions, the flu can progress to severe acute respiratory syndrome. Complications like pneumonia can lead to hospitalization and, in extreme cases, even death. The influenza virus is mainly transmitted from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. It can be transmitted directly or indirectly by touching contaminated surfaces and then touching the eyes, nose, or mouth. In closed or semi-closed environments like homes, daycare centers, schools, or long-term care facilities, outbreaks can occur and the virus can spread rapidly. Take a step towards safeguarding your health and that of those around you. Don't underestimate the flu. Get your annual flu shot. It's a small act with potentially life-saving consequences.
Ever wonder how we've managed to keep some of the most devastating diseases at bay? The answer lies in a simple yet powerful word: vaccination. It's a tool that has saved millions of lives and significantly reduced the impact of numerous diseases around the world. Vaccines play a crucial role in our health by priming our immune system to fight off harmful pathogens. They work by introducing a safe version of a disease-causing germ or parts of it into our bodies. This stimulates our immune system to produce antibodies against the invader. These antibodies then remain in our system, ready to fight off any future invasions by the same germ. It's a bit like a rehearsal for our immune system, preparing it for the real thing. Every year, new strains of flu viruses emerge, which is why it's essential to get your flu shot annually. The World Health Organization monitors these changes and recommends which strains should be included in each year's vaccine. For instance, the flu vaccine for 2024 is designed to protect against 3 or 4 different strains of the flu virus, depending on whether you receive the trivalent or quadrivalent version. Scene script. Vaccination not only protects you, but it also helps protect those around you. When a large percentage of a population gets vaccinated, it's harder for a disease to spread. This is what we call herd immunity, a vital aspect of public health that can protect those who cannot get vaccinated due to medical reasons. Now, you might be wondering, why should I get vaccinated if I'm healthy and have a strong immune system? Remember, even healthy individuals can get sick and spread diseases to others. Vaccination is about community protection as much as individual protection. Moreover, vaccines have been proven to reduce the severity of diseases. Even if a vaccinated person does become infected, the illness is likely to be less severe. So, what's the bottom line? Vaccines save lives. They prevent millions of people from getting seriously ill each year, and they're one of the most effective ways to stop diseases from spreading. Remember, vaccination isn't just about you. It's about protecting everyone in your community, especially those who are most vulnerable. So roll up your sleeve, get your shot, and be a part of the solution. Your body and your community Well, thank you.
Have you ever wondered why the flu vaccination is so important? Well, today we're going to delve into that very topic. Flu vaccination plays a pivotal role in reducing the risk of complications. The primary complication of the flu is bacterial pneumonia, caused by pneumococcus. One of the highest risks of the flu is the exacerbation of symptoms to the point where they can lead to serious consequences, such as pneumonia. Individuals vaccinated against the flu have much lower chances of developing this complication and needing hospitalization. Moreover, flu vaccinations help to reduce absenteeism. Children, teenagers, and adults often have to miss schools, colleges, or work when struck by the flu, compromising their responsibilities and social interaction. So, who should get the flu vaccine? The answer is pretty much everyone. Anyone over the age of 6 months can benefit from the flu vaccine. For children between 6 months and 8 years, 11 months and 29 days, 2 doses are recommended with at least a 4-week interval. Adults and children aged 9 and above should receive a single annual dose. In case of increased virus circulation, which constitutes an epidemiological risk, a second dose may be recommended in the same year for the elderly, immunocompromised individuals, or those with chronic diseases that compromise the vaccine's effectiveness, or even for travellers. Certain groups are considered high risk. These are individuals who, if infected by the virus, have higher chances of developing serious complications or sequelae. Some examples of risk groups in relation to the flu include the elderly, pregnant and postpartum women, health and education professionals, caregivers, immunocompromised individuals, such as those living with HIV, people with chronic diseases, heart patients, lung patients, and people with metabolic diseases like diabetes. There are, of course, some contraindications and adverse reactions. The flu vaccine should not be administered to people allergic to any component of the formula or who have shown signs of sensitivity after application. Mild reactions are expected, such as local manifestations of pain and redness, which usually disappear within 48 hours. Now, you might wonder, what's the difference between the vaccines offered by public and private networks? The private network provides the quadrivalent vaccine for all children from 6 months and adults without age limit. It is an expanded vaccine that protects against 4 types of influenza virus: 2 type A, H1N1 and H3N2, and 2 type B, Victoria and Yamagata strains. The public network offers the trivalent vaccine, which protects against 3 types of the virus, A, H1N1 and H3N2, and B, Victoria strain. So, there you have it. The flu vaccine is a simple yet vital tool in the fight against influenza, a disease that can lead to serious complications. Don't hesitate to protect yourself and your loved ones. Be proactive and get your flu vaccine today.